Thank you, Mr. Chairman, and thank you, Senator Blumenthal, for calling this hearing. I was really proud to have partnered with Senator Warner years ago to introduce legislation that would eventually become the Staff Sergeant Fox Suicide Prevention Grant Program. This program created out of a dire need to improve community-based resources to address the veteran suicide crisis. While veteran suicide remains a critical issue, the VA's work and success with the Staff Sergeant Fox Suicide Prevention Program deserves recognition. Veterans who battle mental health challenges respond best to support from those that they know and trust. I need this program is critical in meeting. I look forward to discussing how we can reauthorize and update this support for veterans and communities across the country. Dr. O'Toole, it's great to hear from VA how successful the program's been. In your testimony, you mentioned that VA supports increasing the authorized funding for the program. What kind of an impact would this funding increase have on the program, and what results should we hope to see?
Thank you, Senator, and thank you for your work and efforts to get this legislation passed initially. Our hope with a reauthorization and appropriations is that we would be able to expand the number of grantees, that expansion of the grantees would both cover all of our states and geographic need areas, particularly those where access to care, access to VA care may be particularly thinned, and also to ensure that the grantees are able to effectively engage specific population groups that may be at higher risk for suicide as well. And that is our hope and aspiration with the reauthorization and appropriations.
What aspects of the program do you think have made it such a success story, and where do you see the program going?
I think the fact that these are community groups that have credibility in the communities where veterans live. These are peers. These are also organizations that are engaging families of veterans are all critical to this. The wraparound and holistic approach to really supporting those veterans is complementary to what VA does. And it really, again, creates a public health strategy and complements a public health strategy for how we're looking at suicide in a way that reflects the complexity of all that goes into it.
The legislation that Senator Warner and I introduced included reporting requirements for VA. What metrics would VA likely identify as important to collect and share with Congress?
I think the measurement dynamic is obviously critical. We need to be good stewards of the resources that Congress provides to us and make sure that the money is going where it needs to go and is having an effect. The key, as we see it, is not just it's obviously important that as many veterans are being reached as possible, but we also want to make sure that it's not just a throughput for lots of veterans, but without also looking at the quality of the care that they are getting, the comprehensiveness of the screening so that the care and the services they are getting is matched to the need, and also that we are outcome driven. We have to be focused on using this grant mechanism to be making a difference in these communities. How many of those veterans are doing better as a result? How many of those veterans are connecting in VA for VA services or in the community for community services as healthcare would require? But these are the accountabilities, these are the trackable metrics that we need to be really looking at.
Very good. Well, that's good to hear. I agree with you 100%, I think, as does the rest of the committee. Thank you, Mr. Chairman.